everybody. I'm Dr. Nancy Wei. I'm the Chief Medical Informatics Officer for MGH, and I'm here today with Dr. Lydia Siegel, Ambulatory Medical Director for Clinical Informatics at Digital Health eCare, and a practicing internist at Southern Jamaica Plain Community Health Center. Dr. Siegel has been working on, for the last year, on a year-long initiative to improve our in-basket by reducing clicks, decreasing overall time spent in the in-basket tasks. And I asked her to join me today to talk about this initiative. Dr. Siegel, thank you so much for joining me. Can you tell us a little bit about the overall scope of this, what seems to me a very important and gigantic project?
Sure thing. Thank you, Nancy, for inviting me to join you for my first two things, maybe my only. The in-basket optimization project is a big project. Most importantly, it's a major transition in how we think about in-basket. We're moving away from using in-basket as indefinite storage, where it's sort of become a cluttered file cabinet, and toward in-basket as a way to take care of active patient care needs that need attention now. The overall scope of the project was just as you said: get rid of messages that don't add any value, add new functionality so you can get more done right from in-basket, and increase the consistency of the experience between folders to decrease cognitive burden. We've actually moved a total of 56 changes into production over the past year to achieve those ends. None of those required advanced knowledge or training or workflow changes. It was just suddenly a little bit easier to do what you needed to do.
Yeah, so a lot of those changes were totally seamless and you didn't know that they were happening. And that was the goal. But I understand something is going to be happening starting next week, Tuesday, so September 14th, as the final part of this big project. Can you tell us about that?
Yes. The final phase of the project that starts September 14th does involve the biggest changes. And that is why we are, talking about it and here to go over it today. The biggest change is that nearly all messages older than 365 days will be marked as done and removed from in-basket.
Why are we doing that?
We're doing it because in-basket has become very slow for many users with tons of messages in their folders. It's become increasingly hard to see what today's work actually is. And in-basket has taken on this sort of insurmountable task feeling. And so we are trying to prepare for a clean slate by getting rid of a lot of backlog that really has been accumulating since our go live, and give people a sort of a faster experience and a cleaner experience to see what they really need to do.
So how can we prepare for this in-basket cleanup that you guys are going to be doing next week?
Great question. Great question. So preparation is not required, but some people may have certain messages they want to keep as reminders of past care or future care or something else that they otherwise just want to hang on to. There are two useful strategies that can help us be more intentional about what we keep in our in-baskets. Number one is use the postpone button for specific messages that you do want to keep. We've added that to most folders, so you can do it right from a message. When you click postpone, it opens a button, it opens a screen called follow-up actions. From that screen, you can do one of four things or in combination. You can add a comment. You can click actual postpone to a later date. You can add a due date, so the message turns red when it's due, or you can add a flag. Any actions that you take in that follow-up screen will exempt a message from cleanup regardless of age. So this is a great strategy when the message itself is what you want to keep. The other strategy is patient list reminders. Those are good to remind yourself about future care that you want to check in on or do or order, but you don't need to keep the actual message that prompted you knowing you needed to do this. So instead of just keeping the message as a prompt, you can create a very specific reminder, such as, order a test, check in with a patient, reach out to family, etc., with a specific due date right from in-basket. These will land in your all reminders folder when they're due. You can also use patient lists for patients you're following, but who don't need a specific task done in the future. These both allow you to safely mark more messages as done for a leaner and more manageable in-basket and a more sort of sustainable view with less cognitive load, less clutter. There are videos and tip sheets that guide you through each of these strategies I just discussed that perhaps you can share with this video.
Those sounds like great tips, just even if we weren't doing this in-basket cleanup, that for everybody to be utilizing and being able to stay on top of the things that they want to stay on top of without cluttering their in-basket and causing, I heard some people's in-baskets take like a minute to load because they have so many messages. So thank you so much for all that you've been doing to sort of help the entire enterprise in this in-basket optimization and cleanup project. And also for working on the videos that are going to be part of this message for people to look at. I really encourage people to spend between 8 and 10 minutes to watch some of these videos. They will really help with understanding how you can use the in-basket to the best of its abilities. So thank you so much for that work.
Thank you so much, and thanks for inviting me.